Did you know that we've had a cure for sickle cell since 1984? That's over 40 years ago, so why don't we hear about it more, and why are so many warriors still living with sickle cell? The answer is because the cure I'm talking about is called a bone marrow transplant or stem cell transplant. Let's run through the basics of what this involves so that you understand why for most warriors this is kind of a double-edged sword. Here's the process. First, you have chemotherapy to wipe out your bone marrow, which makes the sickle cells. Then healthy stem cells from a donor's bone marrow, usually a brother or sister, are infused into your body. If successful, your bone marrow will now produce healthy red blood cells for life. The result of this is that in children with a matched sibling donor, the cure rates are 80 to 90%, which is pretty good. However, in adults, the risks are much higher, so the cure rate tends to be lower. The reason for this is that by adulthood, the ongoing sickling has caused damage to the organs like the lung, kidneys, heart, liver, and this makes it harder to survive the stress of chemo without complications. Adults also have a stronger immune system, which means a greater risk of rejection or graft versus host disease, which is where the donor cells attack your body. This is why newer treatments like gene therapy with Casgevy are giving so much hope, because they use your own stem cells which are edited to produce healthy red blood cells without the same risk of rejection. Now, if you want the full picture of bone marrow transplant, gene therapy, transfusions, and supplements that actually help, I break them all down in my new ebook, Sickle Cell Treatment Guide. Grab your copy through the link in my bio if you want more of this kind of knowledge about your options in sickle cell treatment.